The second paper that I wanted to highlight was a study by some colleagues in Berlin in Germany, sorry, Dusseldorf in Germany, and they used whole exome sequencing to identify the genomic lesions in a series of patients with ALL. Now, in of itself, that was not particularly novel, but what they did is they applied this technique in a very precise clinical setting, and they focused in on patients who had relapsed after an allogeneic stem cell transplantation. So this is a unique patient population, very small, but with a very high risk of death. So these are patients that clearly need the alternative therapies to be identified. And what they were able to do was able to track the mutations across time. So they did the whole exome sequencing at diagnosis, at remission, just after the transplant, and then again at relapse. And this is kind of an unprecedented detail of looking at the genomic mutations in that kind of time frame. And although the patient population was only 10, in 9 of the patients they identified targetable mutations where the patients could be benefiting in the future from drugs that are already available on the market. So it's a clear way where genomic characterization can actually be used now to hopefully improve patients diagnosed with particularly high-risk disease.